Thanks very much for being here. A few months ago, I felt a lump in my neck, which led to a visit to my doctor and a series of tests over the past few weeks. These tests have revealed a growth in my throat that will require surgery tomorrow morning. Any further treatment will be a result of pathology, but I am confident that I will have a complete recovery. We have a lot of work to do for British Columbians, and I'm proud of where we are and the accomplishments we've had to this point in time. Of course, I won't be stepping away from my roles as Premier, head of the Executive Council, and also the leader of the Council of the Federation. But out of an abundance of caution, I've signed an order to appoint Minister Mike Farnworth as Deputy Premier in the event that I need him to assist me with my duties. Everyone knows Mike on all sides of the House. He is well respected after 30 years of being in and around the legislature, and I am confident that Mike and my cabinet are ready to help as they can. It's important, I think, for people to understand that this isn't the first time I've experienced a health issue like this, and it's the extraordinary efforts of our public health care system that gives me complete confidence that all will be well for me. And for those of you out there who do have concerns about this or that, don't wait. See a doctor. Urgent primary care centers are there for this very reason. I think everyone can have complete confidence, despite an extraordinary 21 months of a global pandemic, that healthcare workers, the numerous ones I've met over the past number of weeks in different settings, are not only professional, but they're kind, they're caring, and they're compassionate, and they deserve our support. And that is why I am absolutely committed to continuing the work as the head of the Council of the Federation to ensure that our healthcare system is adequately funded at the federal level, so that we don't just sustain healthcare in British Columbia and in Canada, but we make it better for the future. It is what defines us as a society. It separates us from our cousins to the south. Public health care needs an infusion. I've raised this with the Prime Minister. My colleagues across the country have done that, and I'm looking forward to meeting with him in December to talk about the urgent need to address the Canada Health Transfer, which is just jargon to the people at home, but it is what sustains our system, and it needs a rejuvenation, and I am standing ready after this procedure and whatever treatment is required to take on that task. And with that, I'm happy to take any questions you may have.
Thank you, Premier. As a reminder to everybody on the phone, please press *1 to enter the queue. First question is from Richard Zussman, Global News.
Premier, I'm very sorry to hear about this news. Is this cancer in your throat, and what have your doctors told you about what may be possible about long-term treatments and what impact? I know you're staying on for now, but is there a chance this could have impacts on your ability to do the job?
Well, firstly, the biopsy surgery tomorrow will reveal what exactly we're dealing with. You're not supposed to have growths in your throat. That's the first order of business. The issue with respect to my neck is benign, but in the investigation of that initial concern of mine, another concern was discovered, and that's what we're dealing with tomorrow and we'll be dealing with going forward. But it is certainly treatable, as I've been told, and when we get information from the pathology tomorrow evening, we'll have a course of treatment, and certainly the public will be made aware of that at that time. This is a small town, Victoria. It doesn't feel that way to fast-growing areas like Langford, where I live, but it is a small town, and I've been in and out of hospitals for the past number of weeks, and I'll be staying overnight as a result of this surgery, and that type of information just doesn't stay quiet. And I think transparency is really important in these situations. It's also an opportunity for me to remind people that British Columbians, families deal with these types of diagnoses every day. They do it with strength and resolution. They do it comfortable in their place, in their community, knowing that our public system is there for them, whoever they are, whatever their challenges are. So reminding people of the strength of our system, but the need to make sure we fortify it is why I'm making this statement today.
Richard, do you have a follow-up?
So do we not, because we know that you've had cancer in the past, I don't know what the analysis has been about that. Are you worried at all that this will impact your ability to complete your term as Premier?
I'm worried that it might have an impact on my ability to talk in the short term, which is some comfort for my spouse, Ellie. It'll be quieter around our house, And I'm sure that me not talking for a period of time will be good for everyone. But I have every indication from the surgical team that there's a very positive outcomes from certainly the procedure tomorrow and any treatment that will follow. I have every intention of carrying on. There's a lot of work to do, and I am very anxious to do it. And now more than ever, quite frankly, we've been talking in the theoretical, at least I have, through the pandemic about how resilient our healthcare system is, how extraordinary the people are. I've had the experience and the privilege over the past number of weeks to meet people face to face. Their good humor, their compassion, their empathy, and their absolute professionalism in the most extraordinary of times. So again, I always try to see a silver lining, and I believe that my introduction to a whole host of people in the system has just redoubled my efforts to make sure that we protect and enhance what we have here in Canada, and I am in a privileged position to do that. As the head of the Council of the Federation, I have a good working relationship with the current federal government. I can deal with the Conservatives across the country. Surprisingly, I'm confident that every single one of them, from Jason Kenney to Doug Ford to Francois Legault, who look at the world differently than me, also understand that together we can do extraordinary things, and I'm excited about those prospects.
Binder Sajjan, CTV.
Hi, Premier. Also, sorry to hear about this. I understand you're saying this is a biopsy tomorrow morning. The surgery will reveal what it is. And just wondering, this is your personal health information. Why did you feel it was important to share this with British Columbians at this point?
Well, for a couple of reasons, Binder. Firstly, I believe that this information would become public in some way. I felt that it was important that I speak candidly to British Columbians through you. To say that this is something that everyone experiences. This touches families wherever they may be, whatever their socioeconomic situation, whatever their religious beliefs, whatever their political persuasion. It's events like this that remind us of our humanity. And I'm reminded, and what gave me, what actually quite frankly fortified me last week, Mike DeYoung, who I have battled with for 16 years as a member of the legislature, stood in his place and gave one of the best speeches I've ever heard about his friendship and respect for Mike Farnworth. And it reminded me, and I think all people who were watching, that at the end of the day, politics is just politics, and people are why we all came here. And to have the opportunity to tell British Columbians that we have an extraordinary jewel in our public healthcare system, but we cannot just leave it to its own devices. We need to collectively, with one voice, regardless of how we vote, say to the federal government that we need to reinvent healthcare for the 21st century. And what better time than when we're coming out of a global pandemic?
Binder, do you have a follow-up?
Yes, and I'm just wondering if you can expand a little bit more on what this means for government. I understand, as you said, that you're waiting for the results. Tomorrow, Mike Farnworth's been appointed Deputy Premier. Does that mean that, there's a plan to carry on with, weekly press conferences that as of tomorrow, you would let us know a little bit more detail about what that means for the Executive Council? Can you just give us a little bit more detail about sort of how you next couple of weeks?
No change in terms of the Executive Council. For people at home, that's the Cabinet. I remain what's called the President of the Executive Council, the Premier of British Columbia. What we have done is I did not appoint a Deputy Premier after the last election because, quite frankly, I didn't think anyone could replace Carol James, my friend and colleague. And so we were going on without a Deputy Premier, and I felt that this was an appropriate time to tap Mike on the shoulder and say, hey man, I might need your help. And he, of course, readily agreed. He's already got a very full job as the House Leader, Minister responsible for public safety, ICBC, and a range of other issues. But Mike is the most experienced member in the legislature. And to have him Deputy Premier, I think, is, first of all, a tribute to his service to British Columbia, but also a comfort to people that should there be a reason for me to be out of commission for a period of time receiving treatment, they know that the government's in good hands. And I certainly feel that way, and I wanted to reassure people by making that appointment and announcement today.
Those are all the questions we're taking today. Thank you.
Thank you very much. Live long and prosper, people.